Okay, let me do my final charters. So hello everyone. Hello Facebook family. Hello TikTok family. How we are doing? Am I on Facebook now? I'm just going to pack this hair properly. I'm just going to wait for people to come in. I'm just going to wait for them to come in. All right. Hello, if you're watching, just drop on the comment section and let me know where you are watching from. All right. Akim Gordon, I think you've always been asking me when I'm going to be live, So finally, you've caught me live on my live video, Akim. How are you doing, Akim Gordon? Trust you are doing great. If you are watching our video, kindly drop on the comment section where you are watching from. Also, kindly drop on the comment section to let me know where you are watching from, be it on TikTok or on YouTube. All right. So we have John Oppa. John Oppa, how are you doing? Trust you're doing great. And King Don said, I'm from New York. Thank you, King Don, for joining us on our YouTube live. Akim Gordon said he is good. Akim Gordon, you've been asking me when I am going to come live. Here I am live. So I am here to take as much questions that I can take today. Remember, it's usually my hobby to usually come up to take questions immediately after shooting the video. So we have we have John Oppa. Hi, I'm watching from Abuja. Hello, Oppa, how are you doing? And trust you're doing great. So we have Ubi Heads. Ubi Heads, how are you doing? And where are you watching us from? So we have Stella. Stella, I am watching from Nigeria. Hello, Stella, how are you doing? And trust you are doing great. And trust you're having a nice time. For those that are meeting me here for the first time, my name is Mercy Mary. I am a registered nurse and I'm also a registered midwife in Nigeria, but I'm currently practicing in the United Kingdom as an anesthetics and recovery practitioner. But at the moment, I am currently on maternity leave. Yeah, I am on maternity leave. How we are doing, and trust we are doing great. So during our last live video, I got some questions on the comment section, and that actually prompted me to shoot my videos today. So the videos I shot today were basically questions from my last live that required detailed explanation. So feel free to ask your questions on the comment section, and I will be willing to take your question. So for the person that asked about the condoms, asking me the side effects of condoms, what are the downside of using condoms, I've made your video for you. So I'm just waiting for the video editor to do some final touching. The video is going to be uploaded on our YouTube channel. For those that are finding what are the downside of using a condom, I've made a video on that, and I'll be sending it to my video editor. So we have Ria Vlogs. Ria Vlogs said, I like your hair. Thank you very much, Ria. And somebody asked about antibiotics. Somebody asked about what is the effect of treating STIs continuously. So the person was trying to find out if it has any impact when you continuously treat sexually transmitted infection over and over again. Like there are some people that basically in 1 year, which is 12 months, they've treated STIs more than 8 times, even more than 6 times. There's people that treat STIs back to back in a year. When I mean back to back, I mean people continuously treating STIs over and over again. So I've made a video for you to know the downside. I've made a video for you to know the downside of treating STIs continuously, and also what you can do as an individual to prevent treatment of STIs back to back. So on the video, we made a story of Lisa and Jake. I was able to share the story of Lisa and Jake on the video. So we're going to be waiting for our video editor to pop up. Immediately she finished doing the final touching, I am going to be uploading the videos on my YouTube channel. So if you have been treating STIs and you are worried why is it coming over and over again, that video is for you. And also if you are treating STI and you're worried about it, that video is for you. Treating STI regularly is sign that something is not right. If you continuously treat STI frequently, it is sign that something needs to change. It is a sign that something needs to be sorted out. So I've made a video and I believe you're going to learn a lot from that video on our YouTube channel. So we have Brahman. Hi Didi. Hello Brahma. How are you doing? And trust you are doing great. We have Aspirant. Aspirant said, I am a pharmacy student. That's great. It's nice having you, Aspirant. Do you have anything that you like to share with us on our live video, Aspirant? Kindly let us know. Then during our last live video, somebody talked about sex drive decreasing after marriage. I've successfully made that video finally today, what causes it, and also how you can improve it over time. So like Ella said, all these videos we are shot today, we're just going to be waiting for the video editor to do some final touching up, and I'm going to be uploading the video as soon as possible. So feel free to ask your questions in the comment section. If you need a particular topic to be explained in details in full video, just drop the topic in the comment section. And also, if you have any question about your health, sex, reproductive health, kindly drop in the comment section. I am here to take as much questions I can take. For those that are joining us, my name is Nurse Mercy Mary, and I make learning easy and accessible for all my viewers. If you've not subscribed to our YouTube channel yet, kindly do that. We have more than 600,000 subscribers on our YouTube channel because we have a lot of health content. We keep dishing out health content every day on our YouTube channel. And today we just dropped a video by 5. Yeah, a video dropped on our YouTube channel today, and I'm going to give you a hint of what the video is talking about. So today's video on our YouTube channel was talking about frozen breast milk. Yes, so on the video I shared my frozen breast milk, how I was able to express this breast milk, how I preserve it, and how long this breast milk can last long. Especially for mothers that are planning to do exclusive breastfeeding for their baby, and they are thinking, oh, how do I tend to preserve this breast milk when I'm not available for my child? How long does this breast milk take to like in the fridge? How is it going to stay in the freezer and also in the room temperature? That video practically explains it. So you can go to my YouTube channel and watch it, especially for breastfeeding mothers. That video explained a lot about exclusive breastfeeding, and also I practically use my breast milk to explain it. I showed like there was evidence like my breast milk. So that is that. You can go to my YouTube channel to watch them. So I have a question on YouTube right now. For those that are watching on TikTok, it's both TikTok and YouTube. So I have a question popping up on YouTube, and it says, can someone catch HIV without having sex? Yes, someone can get HIV/AIDS without sexual intercourse. Can someone get HIV without having sex? Yes. There are people out there that got HIV without having sex, and you may want to ask how. You can actually get HIV from blood transfusion. Yes, if the blood is not properly screened, you can get HIV. But these days, before blood is set out to be transfused, the blood is usually screened properly to rule out any disease, to rule out any infection in that blood. So before they give you blood, they usually screen the blood. So that's like partially okay. Then 2, you can also get HIV from sharing sharp objects. When you share sharp objects with people that are infected, there is an increased chance of you going down with HIV. So that is why I remember vividly when the HIV campaign was out in Nigeria, like when they started circulating it, they informed us that, oh, we don't share clippers, we don't share sharp objects. Like when people share sharp objects, don't share it. Make sure your clippers are well sterilized when you go to the barber shop. So there are different routes where you can get HIV aside sex. But I think sex is the most common one. Yeah, I think sex is more common in which individuals can really get sex HIV. And a mother can transfer HIV to a child. So we have mother-to-child transmission of HIV. So that is why care is being taken these days with science and like with new knowledge. A mother can give birth without the child having HIV. A mother can put to bed without the child having HIV. But it is possible for the mother to transfer HIV to the child. So it's not just through sex that HIV can be transmitted. So when you see someone that comes out boldly to say, I am HIV positive, that doesn't mean this person was sleeping around. That doesn't mean this person could have gotten it from sex alone. There are other things that can make an individual get HIV. So that's that. Akim, I hope I've been able to answer your question. Feel free to drop questions on the comment section. I am willing to answer. So I've answered that. And for those that are watching on TikTok, I'm currently answering more questions on my YouTube channel. So if you've not following us on our YouTube channel, I also advise you follow us. And if you have any question on TikTok, kindly pop the questions on. I am going to answer it. So let me see if I have more questions on the TikTok. Eno, just the #1 gifter badge. Eno, how are you doing? Trust you're doing great. Thank you. Precious Isioma, thank you. Mary, thank you. To all those that joined on TikTok, this is me saying thank you. Thank you for joining. Thank you for joining. So I'm going to go back to the to the YouTube to take questions. We have Bayon said, I am a med student. Thank you very much for joining. Bayon, how are you doing? I trust you are doing great. So we have John Opper. John Opper said, what is the side effects of taking contraceptive injection on a breastfeeding mother? So the first thing is, what type of contraceptive injection are you taking? And before you take any form of contraceptive, I believe you should have had a discussion with the doctor, because every contraceptive has their own downside. Yes. Like I always tell people out there, even paracetamol has side effects. Yes, the paracetamol you take for painkillers, the ibuprofen you take for painkillers, they all have side effects. So everybody might not showcase that side effect, might not show that side effect of that particular medications. So the type of contraceptive you are using actually determines its effect. So you have to find out the type of contraceptive you are using as a nursing mother. And I believe for your doctor to have given you that contraceptive, it should be safe for you. Okay. So we have short, how to remove acne from body arm. Acne from body arm. Though I am not a dermatologist. Yes, I am not a dermatologist, but I know acne can be caused by a lot of things. You understand? And one of it could be hormonal. There are types of acne that are caused by hormonal, in which your hormones has to be regulated to help prevent that acne. So there are different causes of acne. So the cause will actually determine how it's been removed. Sometimes some skincare products can help you take it out without really needing to take any medications. So personally, like I earlier said, I am not a dermatologist. What I would advise for you is to see a dermatologist and get to know how to get it sorted out. So Maya Breku said, what pain management options are available during labor? Yes. What pain management options are available during labor? So the first one is that depending on the stage you are in labor, that determines the type of painkillers that can be given to you. You get, depending on the stage you are. Personally, I'll use myself as an experience, as an example, and also the painkillers that were available. In my first child, when I was about 4 centimeter dilated, I was given morphine. Yeah, I was given morphine, and I had to take morphine. So that is also available. But as labor progresses, I had to graduate into using the gasoline, gas in air, where you have to inhale it. In some gas in air, you have to put a mask on your face to get the gasoline. While in some, you have to put it in your mouth and breathe it in, depending on the facility you are. So that gasoline goes a long way to help women with pain during labor. Then another is epidural. Epidural also goes a long way to help women with pain during labor. So before a woman puts to bed, it's also advisable for the woman to speak to the midwife or the doctor, for the midwife and doctor to provide option to show her the different pain options so she can pick one. So at the very beginning, you could be giving those tablets, but as time goes on, they rely more on gasoline and also epidural. That goes a long way to help with pain management. So it depends on how you are able to handle pain, the severity of pain, and also the stage you are in labor, and that determines the type of painkillers that will be given. Okay, so that's that. Thank you very much for watching. Thank you very much for all the likes. I really appreciate it on TikTok. I'm still taking more questions on my YouTube channel. So Bayon, I hope your question has been answered. So another question is from Divine Sunday. Divine Sunday say, after I had a stillbirth, After I had a stillbirth for some months, now I have not seen my menses. So I went and it was detected there's a little fluid in me and I have PID. How can it be treated? First of all, in terms of PID, most times the doctors are going to give you maybe some antibiotics to treat the infection, depending on like what they see there. So I don't advise you take the prescription or you do self-administration. Is it self-administration? Self-prescription or self-medication. Sorry, self-medication. That's what I wanted to say. So no matter what I say here, don't do self-medications. You've gone for a scan and they told you had PID and they told you had some amount of fluid left. So what kind of fluid is left in the uterus and how long has it been? So what I would advise you is to go back to your doctor, let the doctor know what the scan results is so that they can give you adequate treatment. They might give you some antibiotics to help in treating PID. PID simply means pelvic inflammatory disease. I would advise you to get that treated because when you have PID, it can affect the fallopian tube and that can lead to problem having kids. So what I would advise you to do is to go back to the doctor to get it treated properly. So no self-medication, no self-administration of medication. Just meet up with your doctor. Bless you. So I have more questions on, sorry. I have more questions on YouTube. Let's go. So I have Kubangu. Kubangu, if you are watching now, just let me know. I want to take your questions. I don't want a situation where I answer your question and I have to go over it again. So Kubangu, if I pronounce that name well, if you are watching now, just let me know you are watching so that I can take your question. And also Chinere Okafo, if you are watching, let me know you are watching so that I can take your question. So anybody that types yes first, I'm going to take the question first. I just want to make sure that you are online. Kubaku, okay, yeah. Kubaku is online. Let's see what your question says. It says, hello nurse, I have not been seeing my period for 1 month, 2 weeks now, and I went to do a pregnancy test. It was negative. So what could be the problem? So you said 1 month and 2 weeks. That's like, let's say approximately 6 weeks in total, you've not seen your period. There are different reasons that can cause a delay in a woman's period. There are different reasons that can cause, as little as stress. Stress can cause your period to be delayed. It's possible you have to ask yourself this question. Was I stressed out this period? When you are stressed out, that can affect your period. I don't want to go into the medical aspect of hormonal imbalance. Hormonal imbalance can affect your period. Polycystic ovary syndrome can affect your period. Okay? If you are losing weight, it can affect the way your body reacts, affect your period. If you are gaining too much weight, it can affect your period. If you are exercising too much, it can also affect your period. These are the things that can cause your period to be delayed or can even make them to come on time. So what I would advise you to do at this particular moment, if this is the first time you are experiencing it, I might advise you to keep calm first, see how the second month and 2 months go. Okay, then if you find out that now you're not having irregular period, irregular cycle, then it's advisable for you to see a doctor to get proper diagnosis. Okay, as little as losing weight or gaining weight, it can actually affect your period. It can delay it. It can make it not to come on time. So Kubangu, I don't know if you got answer to my question. Kubangu, if you got answer to your question, kindly let me know. Kubangu, so that I can go to Chinere. Kubangu, if your question was answered, kindly drop on the comment section. I'm waiting for okay, yes. So Kubangu's question has been answered, and we are glad we've been able to answer your question. So the next person is Chinere Okafo. Chinere Okafo, if you are watching, kindly type yes in the comment section. Okay, Chinere is watching. So let me read Chinere's question. Chinere said, why is it that when someone pregnant, women walk too much, their buttocks start paining even at month 2? Oh, wait, Are you talking about buttocks pain, like your buttocks at your back? Are you talking about the back pain, waist pain, groin pain, lower abdominal pain? Buttocks is like muscles. The buttocks is muscles. So it's possible you're talking about the lower back pain, the waist pain, the groin pain, the lower belly pain. Maybe I think that's what you're talking about, not necessarily the buttocks. Okay. When those pains happen, it's normal. It could be as a result of those hormones that have changed as a result of pregnancy. It can also be as a result of the baby. The baby is trying to stay properly. Now you're having much pressure. There's a lot of pressure now around there. Before there was nothing there, and now there is more pressure. So what do you expect? So there's gonna be pain. So that's why most women experience those pain in the back, in the groin, in the lower place. But if the pain is severe, please and please see the doctor to rule out anything. In the early stage of pregnancy, if you're experiencing severe pain, see the doctor, let them do a proper checkup. Like if you're not going for your antenatal, start your antenatal as soon as possible so that you can be examined. So I advise mothers, once you notice you are pregnant, the next thing for you to do is to call the doctor and book your next antenatal visit or your next appointment with your midwife. Because when you are visiting your midwife, they are able to tell if you have any issues. They are able to tell if there's any problem that needs to be dealt with as soon as possible. Okay. Chinere, is your question answered now? Chinere, can you let me know if your question has been answered and if you got the answer to your question? So please, if you have any question, kindly drop on the comment section. I will be willing and ready to take your questions on this live videos. Okay, Chinere said her question has been answered, and I am glad I am able to answer your question. Kubanku's question has been answered, Chinere's questions have been answered, and we are waiting for the next question. Who is next? Who want to ask us question, and what could that question be? We are willing and ready to take your questions today. Okay, let's keep the question coming. With the questions, it's able to make the life longer because at least we have something to do. But when there is no question, I might end the live video. Chinere said back buttocks pain. Buttocks is majorly muscles that are there. Your buttocks is muscles. It's like before you get to the bone, it's quite far. So if you generally what I would advise you after my explanation is if you are worried, if it's something concerning to you, it's getting too much, just speak with your midwife or speak with your doctor about it. So we have question from Bion. What is a ventilator? What is a ventilator? A ventilator is like, are you talking about in theater, like, or generally? Ventilator helps with breathing. Ventilator helps with breathing. It helps like patients breathe. It helps to keep the patient stable. It's generally what helps with breathing. That's what I will say in a simple words. Ventilator helps with breathing. It helps to get oxygen. It helps you to get oxygen, and it also helps you to take away carbon dioxide what you breathe out. So ventilator is more or less acting like a respiratory system. I think Bayo said Bayo was one that said he's a medical student. I think so. Brian is a medical student. Okay, yeah. So ventilator generally helps with breathing. It helps with breathing. That's what I see ventilator as. It helps with breathing. It helps you breathe. So let's keep the questions coming. Okay, let's keep the questions coming. Okay, Kimberly says, was watching the Bonds lecture and you said you would post on the rule of 9, but I can't find it. Okay, Kimberly, the rules of 9. Are you sure I don't have that video on my YouTube channel? That's a video for medical students. Do I have that video on my YouTube channel? Rules of 9. Okay, I'll try. Kimberly, I'm going to make the video for you. I'll just screenshot it. It's belong. I actually did a video for nursing students, and I think that video is for nursing students. But I'll try and see if I can make that particular video for you, Kimberly. Most of my nursing student video, I prefer to use a blood. I prefer to use a whiteboard because it makes me explain better. I'll try and see what I can do. If I can make a video on the rule of 9 without the blackboard, then I'll let you know. Okay. So we have Stacy Weedle. Hello, love, from Scotland. Hello, Stacy. How are you doing? And how is Scotland this evening? Shivan Gupta say, I have a cardiac arrest. Okay. I made a cardiac. For you to have typed this video, it's possible the cardiac arrest must have been resolved. And how are you feeling now? What's your question in regards to cardiac arrest? So we have Akim Gordon. I like your background. Thank you very much, Akim. Thank you very much. I really do appreciate it. And please, if you are watching this video, if you are watching this particular live video and you've not double tapped my screen, you've not liked our video, kindly do that. Kindly like our video. That's going to go a long way to show me that you appreciate what I'm doing. So if you are watching right now, just double tap the screen and you've liked the video. It's easy. Just double tap the screen and you've liked the video already. That's all you need to do, and nothing more or nothing less. Okay. Thank you very much to all those that double tap the screen to like the video. Let's keep the questions coming. I am willing and ready to answer your questions. Let's keep it coming. Let's keep it popping. Let's keep our questions coming. I'm ready to take as much questions today. Like during the last live video, someone was about to ask a question, but I didn't really have much time again. I had to go offline because my baby needed me. So the person is not here now. And I think the person was asking when my next live was, but I couldn't really say when my next live is going to be. But anyway, it's good. So I just saw a question on our YouTube channel, and somebody is asking, what is sedation and why is it used in ICU? When you say, in a simple term, let me just put it that way. In a simple term, when you are sedating someone, you're making the person sleep. That's what it is. You are making the person sleep. It is used in ICU. Why is sedation used in ICU? It all depends on the person's condition. So it all depends on the person's condition. But sedation in general is to make somebody sleep. And most times they sedate using drugs. They sedate using drugs. And when you sedate, they use, most times the ventilator is what they use to make you breathe. So depending on the severity of the person, depending on the case at that particular moment, sedation might be the only way they can actually help the person recover. When you sedate a patient, it's actually to make the person sleep. It's actually to make the patient rest. They use medication, some drugs, relaxing the muscles in such a way that ventilators can help the patient breathe. Especially when the patient is not breathing properly. So the best thing they have to do for that patient is to sedate the patient and allow the machine to take place or take charge. So that is this. So I've answered Blonde Girl. Blonde Girl, I hope you've gotten answers to your question. So we have Nunes. Nunes, hello, beautiful. Hello, Nunes. How are you doing? So we have Prince Oyendika. Oyendika, good evening, us. Good evening, Oyendika. How are you doing? Is it any side effects of immune booster drink? Immune booster drink. Generally, what I tell people, as far as you are taking this thing, is not natural. Everything has its own side effects. Some people might react to it. But since it's an immune booster, you can take it to boost your immunity, but just observe your body. If your body likes it. What I mean by if your body likes it, if your body is not allergic to it, if your body is not showing some funny symptoms after you've taken it, then as far as boosting your immune system, you can have it. So that's what I think. That's what I feel you should do. Okay. But I don't really know any side effect of immune booster drink, except I study about it or read about it. I have no idea about immune booster drink. I've not had one, so I don't really know the side effects attached to it. So I have Akim Gordon. Akim Gordon says, why some women can have a baby and some can't have any? So Akim Gordon is asking, why some women can conceive, get pregnant, and have a baby, and some women cannot have. Some women cannot have children because of different conditions. Some women might be battling with PCOS. Some women might have, there are a lot of different fertility issues that can affect women and same way affects men. Sometimes some women cannot have children not because of their own issues, but because of the men. So there are different fertility issues that can make a woman not to get pregnant. For example, maybe the fallopian tube has issues. Maybe the woman has PID, there's caries in the fallopian tube. Maybe the woman has serious fibroid that is affecting where the baby is being located. Maybe the woman is past the age, like she doesn't really have good eggs anymore. Age can also tell. There are a lot of reasons why a woman cannot get pregnant. Maybe probably I will make a video on that. Reasons why some women cannot get pregnant. So I'm just going to screenshot it and make a full video explaining those medical conditions that can make a woman not to get pregnant. So expect a video for you, Akim Gordon, soon. So expect a video. I'm going to be making a video for you, Akim Gordon, why some women cannot get pregnant, can't have any. Some women, I think they are naturally blessed. Their hormones are good. The hormones are actually working in their favor. Some women, they don't need much, or they just need to get pregnant. They can even give you 10 children at once. So I'll make a full video explaining that, Gordon. Hopefully you get your videos soon. So we have Blonde Gay. Blonde Gay, your question has been answered. Thank you. Thank you very much for staying on our live. Then we have YouTuber Sandeep. Hi, YouTuber Sandeep. Trust you're doing great. Then we have Sandra Eze. Sandra, how are you doing? And trust you are doing great. Sandra Eze said, how can doctor find out that someone has PID? I'm coming. Sandra, just give me some time. I need to sort out my TikToks. Okay, that's sorted out. Okay, back to Sandra. Sandra, as I said, how can doctor find out that someone has PID? Okay, doctors can find out that you have PID, that someone has PID by your symptoms. What did you tell them? The pain, STIs, like are you treating STIs frequently? Are you having abdominal pain? And they can also see that in ultrasound. So if you are skeptical, you are doubting if you have PID, why don't you just do an ultrasound scan? That can actually show if an individual has PID or not. So I don't know if that question is answered, Sandra. So Blonge asked, how is pain managed in hospice care? Oh, I've not worked in hospice care sincerely. I've not really worked in hospice care, so I don't really know how pain is managed in hospice care. So I have no idea about hospice, how pain is being managed in hospice care, sorry. Because sometimes these people have pains that are very severe. Sometimes the normal painkillers is not working for them. Like, I think some of the painkillers that they use, is it epidural? I think they might use, I don't really know how it's been managed, but I think they might use epidural to help them manage pain. They might use stronger painkillers like the morphine. They might use stronger painkillers like oral morphine. I don't really know. I don't work in hospice. I don't want to give you wrong information, but I think that most times when someone is in hospice care, the pain might be really severe. They might use epidural. They might use some more stronger painkillers like your morphine, Oromorph. I'm trying to remember some stronger painkillers, but my head is not capturing it. Well, I know they use sometimes they're in pain, so I can't really say. Sorry, blonde gay. I don't really have answers to your question, but maybe I'll make a video for you. Let me see. Depend. I might just quickly chip that in one of my videos when making it. I will study about it and let you know how pain is being managed in hospice care. Okay, thanks. All right, blonde gay. Sandra Eze said, how's your baby boy doing? He's fine. At the moment, he's sleeping and he's with his daddy. So let's keep the questions coming. Do we have more questions for me today? Do we have more questions or we are all done? Should we end the live today? We've taken a lot of questions. That's a good one. I'm glad I'm able to take a lot. Lord said, what does discharge from the NICU mean? Okay, discharge from NICU simply means discharge from neonatal intensive care unit. Okay, that means the patient is free to go home. Discharge from the NICU, discharge from neonatal intensive care unit. Neonates, like small babies, preterm babies, they keep them there, like small babies. So when they discharge the patient, it simply means the patient can go. We're done with you, so you are fit, everything is fine, you can go. So I think if that's what you mean, then that's it. Discharge from the neonatal intensive care unit. So for mothers that when they gave birth to their baby, there were issues, the babies need to be monitored, so they take them to neonatal intensive care units. So these babies are being taken care of. So when they are fit and okay, they discharge them from the neonatal intensive care unit. I think they should be ready to go. So we have Miss Sarah Hassan Oro said, hi, can you please help with GIT pharmacology like peptic ulcer drugs? I think I've made a video on my YouTube channel on peptic ulcer drugs. I think I made a video on that. I've made a video on GIT pharmacology where I talk about using antacid. Antacid can be used to manage peptic ulcer, and also some antibiotics, can also be used. So there's usually a combination of drugs to treat peptic ulcer. So whatsoever I'm going to be saying here is not for you to self prescribe. Please and please always consult your doctor. But from what I see from your question, I feel you are asking about you're asking from the point of a student. You're asking from the point of a student. So there are different combination of drugs that can be used to treat ulcer. So most times doctors don't use one particular drugs to treat. So they combine drugs together. They give it to ulcer patients to help them alleviate and relieve the pain. Sometimes there are some school of thought that says peptic ulcers cannot be treated. But rather, peptic ulcers is managed. Okay, so that's what you should take note of. So we have Pama Damak. Pama Damak says injection. Pama Damak says death patient care. Pama Damak, I don't really understand. I think I have these questions are coming from nursing students' point of view. Do you want me to make more videos for nursing students? Please, please, please. Let me know if you want me to make more videos for nursing students, and also what topics as a student you are finding it difficult and you need my videos to help you explain. All right. So nursing students, if you are finding a particular topic difficult and you need me to make a video on it, just let me know. I'll try and see what I can do to pop the nursing topics in, and I will create a playlist to help you. So that's what I have to say for the now. So Sandra is this says, my husband will come back by July and I want to get pregnant. What can I take or do to get pregnant fast? Wow. See, let me tell you something. Even if your husband comes back in July and you are not ovulating, you will not get pregnant. Yeah. Even if your husband comes back in July, let me repeat it again, and you are not ovulating, you will not get pregnant. So what I would advise you is that your husband is coming July and we are in March. January, February, March, April, May. The first thing you should do in these 3 months is to calculate your cycle. The first thing you should do in these 3 months is to calculate your cycle. Know your ovulation cycle. So that when your husband comes by July, you will know the right time to have sex. So if, like Sandra, if your cycle is regular, you know your cycle is regular, you are seeing your ovulation, like your ovulation is regular, everything is regular, you know your day cycle, know your ovulation day and try to have sex with your husband on that day, and that might help you get pregnant. So the most important thing for you to do is to find out, are you having a regular cycle? And if you're having a regular cycle, the next thing you should ask yourself is, when is my ovulation? And if you know your ovulation, just make sure your husband is available in that particular day in July, so that something can happen and you're going to increase your chances of getting pregnant. Sandra, have I answered your question? So we have protocol death patient care. Protocol care patient death. See, where are you from? I think I'm having people from nursing school. I don't know which nursing school in particular. Please just let me know where you're watching from and which nursing school, because different nursing schools have their own different syllabus. They have their own different syllabus and they have different expectations from students. So let me know which nursing school or which country you're actually asking me to do a video for. So, okay. So we have Twilight Folk Days. Hello, starting my nurse apprenticeship in 2 weeks. Wish me luck, guys. You just got a new subscriber. Which country are you doing your nurse apprenticeship? That's good. I wish you the very best in your nurse apprenticeship journey. But I want to know, which country are you doing the nurse apprenticeship, and if it is okay in that particular country. I'm not talking about in a particular country, they call them auxiliary nurses, which the Nursing and Midwifery Council are not in support of. So I would like to know, which country are you, and also if your Nursing and Midwifery Council is in support of nursing apprenticeship over there. Anyway, in whatever you do, I wish you the very best and I wish you success. So we have Pretty EOG TV. Wow, sis, I met you here. Yes, you are meeting me here. How are you doing, Pretty EOG TV? So we have Pamak Demak. Where are you? Where are you from? Nurse job. I am from Nigeria, but I'm currently working in the UK. Pretty EOG said, I'm a registered nurse from Nigeria. It's nice having you, Pretty OG. How are you doing? And how is your profession? And how is your job? Did you work today or you've been off? So Pamak Dema say, I don't understand Slovi English. I think I don't understand what Pamal is talking about. I'm from Edo State, Pretty EOG TV. I am from Edo State. Yeah, from Edo State. We have Hassan Oro said, I'm a student nurse from Kebbi State College of Nursing, Nigeria. Can you help us with systematic pharmacology? I have made some. Okay, if you are a nurse in Kebbi, let me give you a tip. I have a class for nursing students. Like, I have a class for nursing students on Telegram. Yeah, so if you subscribe to the classes, you have access to all the voice notes that are going to help you in nursing school. And these voice notes are grouped according to systems. For example, pharmacology. For example, we have digestive system group, respiratory, nervous system group, where we explain the various topics in nervous system. If you check the digestive system group, you see the various topics in digestive system well explained. So if you want to join the class online, all you have to do is to send a message on WhatsApp, or you send me a message on Instagram. We'll tell you how to register for the class. Since you are from Nigeria, we have classes made specifically for Nigerians to help them with the Nursing and Midwifery Council exams. So that's that. So Sandra said, yes, nurse, my cycle is 29 to 32 days. My problem is that any cycle I got, I always ovulate day 14. I think you should check well. You should check well. Then that period, like 29 to 32, that's your ovulation is going to be around that same date. So what I would advise you to do within that day, before that day, you can even have days. Since you have a day of your ovulation, during that period, it's very, your fertile stage. So try and have sex during that period. Pretty EOG TV says, what's your name? My name is Mercy Mary, and I'm known as a nurse with a difference. I'm a registered nurse midwife in Nigeria. Yes, I'm a registered nurse midwife in Nigeria. Blonde Guest says, in preparing the patient for insertion of pulmonary artery catheter, what should the nurse do? Pulmonary. Okay, I'm not a respiratory nurse. First of all, I am not a respiratory nurse, so I can't give useful advice in regards to respiratory nurse, because I think this question is for those that are specialized in the respiratory department. So personally, I can't explain that. Okay, blonde girl say I'm an ED nurse. That's good. That's great. It's nice meeting you, blonde girl. And where do you work? Where do you work, blonde girl? So there are some questions I can't answer that specialists in that field, they will be able to answer. So I don't end up giving you wrong answers. So I believe in that respiratory catheter, the first thing that I know in all nursing procedure. Okay, that's good, blonde girl. It's nice having you around. So in all nursing procedure, one thing that is common is to confirm the patient's name. It's very common. Check out for the allergic reactions of the patient. Go through the history of the patient to find out what the patient has been used to. I think that's common with all the procedure. Check the vital signs before most procedure, like practically before most surgical procedure or all surgical procedure. It's very important for you to check the vital signs to have a baseline of the patient, just in case while doing it or after doing it, there's a drop in the patient's vital signs. That gives you a clue on what to do. So it's very important for you to check the vital signs of the patient before the procedure. And as an ED nurse or a respiratory nurse, you will be trained on what to make available. So you're going to make the things available, what is needed for the artery, whatever. So you take note of what should be needed. So I am not a specialist in that field. I think the person that should be able to answer that question should be a specialist in that field in particular. Pretty EOGTV, do you always go live? I don't always go live, but I try as much as possible to be live. I don't know if you get it. I don't always go live, but I try as much as possible to be live these days, because on the comment sections, I have tons of messages, and these tons of messages, I cannot answer them. So the best thing I do is to come live and take questions from my beautiful audience. Okay, so that's what I normally do. So Main Sarah Hansan, okay, Main Sarah Hansan, you're going to contact me through my Nigerian number, and that is 081. Are you writing it? 081 Min Sarah Hassan. Or can someone help him write it on the comment section so he sees it, please? Someone should just volunteer. I write it and send it. 081 23 71 9105. So you can reach me with my Nigerian number, then I'll provide some details for you on how to go about with the registration. So that's that. So if you are watching this live video, kindly double tap the screen and like. So that helps us to know that you're actually enjoying our live video. And also that shows YouTube that you are enjoying our live video. Thank you very much for all the beautiful nurses that joined our live video today. And thank you very much for all the student nurses, the medical students, the pharmacology students that joined our live today. Hopefully in the future, I hope to do more collaborations with nurses. I hope to do more collaborations with nurses students. So I tend to answer their questions and provide useful guidance when necessary. Feel free to double tap the screen to like our videos. Okay. So we have a question again. We have a question from YouTube. Please double tap and make it 20. Please. Mary, if you've not double tap the screen to make the like 20. Mary, I want to take your questions now. I'm going to take a question now. If you've not double tap the screen to make the like 20. Because we have 19 likes now, which is good. So Mary, I'm going to take a question now, and that is, hello Ma, how are you doing today? I'm doing great. It's nice to see you on my live. It's good to see you. It's good to see you too, Mary. Please, I need a method of natural family planning without pills or implants, even condoms too. Okay, you need a natural method for family planning. One of the natural methods for family planning is tracking your ovulation. Tracking your ovulation and running away from sex on your ovulation. That's the most effective. No, it's not 100% effective. Okay, so, let's be serious. Okay, Tracking your ovulation, knowing the day that you're ovulating, is one way to actually prevent pregnancy. So, because when you know the day you are ovulating, you tend to avoid sex that day. Okay, that's why I made a video on signs of ovulation. So when you watch the video on signs of ovulation, you're able to know, okay, I'm ovulating this day. This period is not safe, so let me leave. So when you know your cycle, you know your safe and your not safe cycle, that gives you a clue if you have to have sex or not, if you want a baby and if you don't want a baby. That's the most natural way of family planning. And the withdrawal method, advising your partners to do withdrawal method. But not all withdrawal game is 100% because sometimes pre-com, pre-ejaculation can actually make a woman get pregnant. Because some pre-com, some pre-ejaculate contains a little amount of sperm. So I think the most effective one is to know your ovulation and stay away from sex during that period. So that's what I advise. Please double tap the screen to make it 20 likes before we end the live video. So, oh my God, I have a question on the comment section, but I am not speaking the language. I think the person wrote the question in Korean. Sorry, I can't read that question. And I only understand English, and I can only respond in English. So it's not my fault. I don't understand what you typed down there. Kim Jong Un, North Korea. I think I tried pronouncing that Korean name. Kim Jong Un, North Korea. So we have Mary D. Nymphas. Say thank you, Ma. Thank you, Mary. Remember, Mary, to double tap the screen just to like the video if you've not liked it. Feel free to double tap the screen to like our videos on YouTube if you've not. And if you are watching us on TikTok, I would advise you to also watch us on YouTube. I would advise you to check our videos on YouTube. We have a lot of interesting content on YouTube. So I have Chinecherem Immaculate. Good evening, Nurse Mercy. Good evening, Chinecherem. How are you doing? And trust you're doing great. Welcome to Nurse Mercy Mary Live. We'll be going offline soon. Okay, just double tap your screen. Like if this is your screen, just do it like this. So people are clicking the like emoji, yes. But if this is your screen, for example, this is your screen, just double tap it, 1, 2, and it likes the video and it likes our live. So if you are watching and you've not done that, I would advise you do so. Thank you very much. So we'll be going offline soon. I've tried. It's almost 1 hour on our live video, and that is a good one. We've done lots for today. We've taken a lot of questions on our YouTube channel. So I've spent 53 minutes. I think I have 7 minutes more to go. I just want to make it 1 hour, a round figure number before I go. So if you have any question, you are very lucky in the next 7 minutes to ask the question before Nurse Miss Mary go offline. It's so beautiful. I'm so excited today because I also have other nurses on the live video. It's nice seeing you all on the live video today. I feel blessed to have you all on the live video. How is this? So we're going to be going offline soon. Hello, I got congrats. Lady Sky lit up Rose, Nurses Lecture Room Gift Gallery. Thank you very much, Lady Sky. I think Lady Sky is she's always giving me a lot of diamonds in my life. Thank you very much, Lady Sky. I'm smiling because you gave me diamonds on my life. Thank you very much. Thank you, Chichi. I really appreciate. Thank you. Thank you, Lady Sky. Thank you very much, Lady Sky. I really appreciate your contributions to my life on TikTok. Okay. Though I'm not used to TikTok, but anytime I come live on TikTok and Lady Sky is on TikTok, She usually gives me a lot of diamonds. Thank you very much, Lady Sky, for that diamond. I do appreciate and I don't take it for granted. So I have Chinere Immaculate. Nurse Mercy, please, can early pregnancy cause stomach cramps? Yes, it's normal. So when your pregnancy is at the early stage, you can feel a little bit of discomfort. It's okay. But if you are not comfortable with it, kindly speak with your doctor, okay? Since you said it's cramps, like a measurer cramp things, so I think that should be okay. But if it's severe, don't hesitate to see your doctor. Okay, Chinecherim. Did I pronounce that well? Chinecherim. Chinecherim. I can call you Chichi, right? Chichi. Did I pronounce it well? Okay, so if you are watching, just double tap the screen and like the video. Okay, just double tap the screen and like the video. Oh, okay. Blonde Girl asks, what is pseudosciences? Oh, I've made a full video explaining pseudosciences on my YouTube channel. Pseudosciences is simply forced pregnancy. You're having a false pregnancy. That's what pseudosciences is. Like, there's some people that believe they are pregnant, but they are not pregnant. I made a full video explaining what causes pseudosciences. I explained the different causes of pseudosciences, like getting a false pregnancy test. So especially for women that are trying to conceive sometimes, when they notice some signs, they feel they are pregnant, but when they go for scan, they are not pregnant. So pseudosciences in simple terms simply means false pregnancy. What's that video called? Okay, just type "forced pregnancy by nurses lecture room." I believe it's going to pop up. Forced pregnancy by nurses lecture room. I can't remember what I titled. I think it's forced pregnancy. Type "forced pregnancy by nurses lecture room." I believe the video is going to pop up. I've made a video explaining it. I remember vividly we're making a video on it and also talking about what causes it. Yeah. So you can also watch the video. Some people even they'll see their tummy keeps increasing and they feel it's pregnancy, but they go to the test, they go to do ultrasound and there's no pregnancy. So people show sign of pregnancy, vomiting, nausea, loss of appetite, but yet they are not pregnant. So pseudosciences simply means false pregnancy. I think you should watch the video. Thank you very much, Blonde Girl. So I have 3 more minutes left, so I'll be going offline. If there's any question, kindly let me know. I remember I made a video on false pregnancy. That was last year. I think that was last year. I made a video on false pregnancy. I can remember. I have it on my channel. Yeah. I have it on my channel. So Chichi said, and also Ma, after taking clomiphene, when can I use pregnancy test? After taking clomiphene, did you have sex? If you have sex, 2 weeks after you had sex, you can do a pregnancy test. And if you know you had sex on your ovulation, that's what increases the chances. Okay. So after taking clomiphene and you had sex, you can do a pregnancy test at least 2 weeks after you had sex, or immediately you miss your period, you can do a pregnancy test. Don't go and do a pregnancy test 2 days after you had sex with the mindset that you're pregnant. It's not going to show, even if you're pregnant. So you have to wait for at least 2 weeks. It's advisable 2 weeks before you do a pregnancy test. And while you are doing it very early, you can use the early morning urine. Okay? Chichi, did I answer your question, Chichi? So I have how many minutes do I have? I have 1 more minute to go. Chichi, okay, Chichi question has been answered. We've answered a lot of questions today, and I'm so super excited that I got 40 diamonds. I got 40 diamonds, and I got a gifter. I got 1 gifter. I got 40 diamonds. That's great. That's huge. I really appreciate those that gave me the diamond, and I do appreciate the gifters. Thank you very much. Thank you. So I have less than 30 seconds to end the live. What are the signs of respiratory distress in a newborn? I think the way the baby is breathing, yeah. And you might even notice some bluish discoloration. Normally they count the respiratory rates. Like if the baby is having difficulty breathing, normally when you breathe, all of a sudden you might hear some Sometimes I think wheezy respiration can be a sign of respiratory distress for a newborn. You start seeing bluish discoloration in the body. That's also a sign that the baby is not getting enough oxygen at that particular moment. And also, if a baby did not cry, that's why it's very important. Like, a baby should cry when they are giving birth to. So if a baby did not cry, you see them beating the child, open your mouth, open your mouth. So if a baby is not crying, that's a sign that something is wrong. It's possible the baby is not beating. Let's check properly. So they start checking and seeing, okay, is it breathing fine but not crying? Is it crying but not breathing fine? So I think that's what you should take note of. So we've completed 1 hour in our live video. And this is me saying thank you all for staying in our live video today. Thank you all for dropping your questions. To all the nurses that are present on my live video, thank you very much. To all those that sent me stars like diamonds on my TikTok, this is me saying thank you very much. I'm not really familiar with the TikTok and how it works, but when I see diamonds and I see some gifters, I am amazed. Maybe I should go and study more about TikTok and find out what the stars and diamonds are all about. Thank you very much. I still remain Nurse Miss Mary, popularly known as the nurse with the difference. And for the student nurses that are waiting for me to make a video for them, kindly send me a message on Instagram and let me know. And for those that want to register for our online class as student nurses, kindly send a message on Instagram. I'm going to see what we can do to include you in the classes. Okay? So far, so good. We're done for today. We've tried, we've answered a lot of questions. And this is me saying thank you all. Thank you all. And if you've not double tapped to like our live videos, kindly do that. It's going to go a long way to show that you appreciate the efforts that we put to take your questions. I'm super excited today. Thank you very much and see you in my next live video. Bye. Bye, everyone. Bye-bye. See you in our next live video. So I'm going to end that of YouTube.